Hello and welcome to this EUTOPIA Learning Community podcast. My name is Modest Vengust from the University of Ljubljana, and in this series we explore how different ethical perspectives shape our understanding of animals, care, and the veterinary profession. Today's episode is titled Care, Vulnerability, and the Ethics of Ending Life, Insights from Human and Veterinary Medicine. We will look at how animals support human life as companions, helpers, and beings in our care, and how difficult ethical questions arise when life approaches its end. To explore these issues, I'm joined by two remarkable guests, Dr. Svenja Springer, whose work focuses on veterinary ethics and the human-animal relationship, and Dr. Denis Dement, who works in human end-of-life decision-making and the ethics of euthanasia. Together, we will reflect on care, responsibility, emotional burden, and the ethical dilemmas that arise when we make decisions for vulnerable beings, whether human or animal. You will find short biographies of both guests in episode description below. Thank you both for being here. To start us off and to get a sense of your personal motivations, how did you first become interested in the intersection of ethics in your professional practice? And Svenja, may I invite you to begin, please?
Of course. First of all, thanks for the invite. So I'm interested in the intersection of ethics and veterinary medicine. So as is often the case, it is based on personal experiences I made during my study program. And actually, we had two dogs, and both of them passed away within 1 month. And one dog was euthanized because this dog was suffering from liver cancer. So it was an acute phase, and we needed to decide very quickly, euthanasia, yes or no. And then 3 weeks later, the old dog just passed away very smoothly. Actually, it was, when I can tell it in that way, it was a beautiful death at home. And this, I was confronted with so many questions because there were specific dynamics within the family, but also from the medical point of view, what I experienced as a student, as a vet student there, I was confronted with a lot of questions with all the medical textbooks weren't able to give me any answers. And then I decided, well, maybe I should dive into this topic. And then I searched for a person who may supervise me in this topic for my diploma thesis, euthanasia and small animal practice. And then I landed actually at the Messerli Research Institute, where the Professor Herwig Grimm started just in 2011, the professorship on ethics of human animal studies. So, and I'm still here and I'm interested in that. So to conclude here, it's often personal experiences from my point of view, which brings you to also the research interest, and that it's very interesting to work in this field.
Denis, we'd love to hear your path as well.
Also from my side, many thanks to invite me to wonderful Ljubljana and to be here. So my background is in nursing, and so how I became involved in ethics by accident. And meaning, so I'm trained as a psychiatric nurse. So I worked in the work field for about 10 years, then made a step to education. Every 5 years in our Flemish universities, there's a quality assessment. And so we had a quality assessment, and so our dean made clear to everyone, okay, if you submit an abstract to an international conference and it's accepted, then you're allowed to go. And so I supervised a bachelor thesis on euthanasia for people with mental disabilities and the role of the nurse in this process. And so with approval of the student, I submitted this abstract to a conference in Malta. And then it was accepted, I gave the presentation, and it gained a lot of attention, and people were really very interested, asked lots of questions, and that's how I had the idea, okay, I have to do something with this. And then, similar to you, I searched for a supervisor to do a PhD thesis on this topic, and that's how I got involved in the euthanasia debate for humans, and specifically in my case for people with mental disabilities.
Thank you both. That already highlights how actually ethics shapes your work, right? But let's build on that by looking at the many roles animals play in human life. Animals do support humans as companions, therapy partners, working animals, or food animals. How should we ethically understand the dependence and reciprocity between humans and animals across these roles? And Svenja, would you like to begin, please?
Of course. Well, definitely that's a pressing and interesting question. I think when we would like to understand the ethical relationship between humans and animals across various roles involved, we need to highlight several important considerations. And turning, for example, to the interdependency. So we know there's this big issue of companionship, and we know pets provide emotional support and companionship. And we just recently conducted a study in 3 European countries, in Denmark, Austria, and the UK. And based on the data we gained from over 2,000 dog and cat owners, they stated that 3 out of 4 dogs and cats are kept as companions for the human being. So this is actually the main reason we can find why we are keeping pets such as dogs and cats. And while they offer here the support, emotional support and companion animals, I think we can also say there's an interdependency that we, of course, take care of them. We provide them home and shelter. And I think there's a mutual benefit for both sides. Same, maybe also with working animals. So animals like dogs in service roles depend on humans for training and care, while we know humans rely on their skills for tasks such as search and rescue assistance for individuals with disabilities, for example. Turning to the food animals, of course, the relationship is here much more complex. It raises several ethical questions about welfare, the human treatment during their lives, but also this role often leads to the discussion about what you just had also in your project, the moral implication of consuming animal products. So this brings then, when I'm thinking about the different roles, and of course every veterinarian, when we think about the veterinary profession, veterinarians can find themselves in this different relationship between animals and humans. So they're veterinarians trained for laboratory medicine. So they're trained to keeping care about pets. They are trained to take care about food production animals. So they're actually aware, and they're always at the forefront what kind of roles specific animals play in a specific context. And I think that makes it also a huge topic within the field of veterinary medicine. And the ethical consideration here also from my point of view, from the veterinary side, is of course thinking about the welfare issues. So regardless of their role, animals of course should be treated with respect, and their welfare should be prioritized in a way including not only nutrition and habitat, but also, of course, the health cares. But these roles, and this is also what we need to think about, they're impacted by or affected, of course, by cultural perspectives and also religious perspectives. We know that different cultures have varying views on the roles of animals, which can definitely influence the ethical consideration. So it might be totally different when we think about cultures, not the Western European cultures, but turning to Asian countries or India or stuff like this. So this definitely makes an impact also on the roles and how we treat the animals.
Thank you, Svenja. Dennis, from your perspective in human medicine, how do you see this continuum of support and dependence?
So from a medical point of view, I think we have to make a distinction in between hospital care and non-hospital care. And so the animals do play an important role in the process of a patient. So that's clear. And so what we are seeing now in healthcare is there are processes or there are projects to involve animals into daily care. So for example, there are elderly homes and they have their own dog. So it's not the dog of a patient or an elderly, but it's like one dog for the complete elderly home. And it is beneficial for the patients or for the residents to take care of this dog. So that's one example. Then another one which I support a lot, in Brussels there is an opportunity in the university hospital, and it's called Villa Samson. So Villa is like a house, a standalone house, and Samson is a very famous television dog. It's a doll, it's not a real dog, It's a very famous one in the Dutch-speaking part of Belgium and in the Netherlands. And so they support it financially, and they give the opportunity to hospital patients to meet their own pet. And it can be their own dog or their own cat or bird or fish, but even a horse. This is not solely for end-of-life patients, so this can be for all patients when it's medically possible to meet their pets. For example, patients in isolation, patients at the intensive care unit, these are not able because they have to be transferred within the domain of the hospital to this standalone house. And then I think this is a nice way to see how pets, and even large pets, do have an important role in the process of a patient to get better.
Mhm. Yeah, I think that's, is it okay? I think that's very interesting. And I think what you just highlight here is that they have this kind of power to build up relationships where also what we know that they have this kind of responsibility towards a pet, and this is what they learn from that, and that giving the power to care and to build up compassion and this with respect and also responsibility. What we also observe, for example, I'm treating animals of homeless people, and when they have a pet, they say, well, I'm in a very, very dramatic situation, but with my pet, I have the feeling I'm trying to get more control over my life. I learn how to take responsibility. I can build up relationship, and within this relationship, I would like to provide the best care for my animal. So what you just said, I think that this is really a mutual benefit we can observe, especially in this specific situation, as you also just mentioned. And this is also what we can observe here in the specific situation, keeping an animal when you have no home right now, for example.
I think an important thing as well, taking care of the homeless people, same for people with psychiatric vulnerabilities, is there is no judgment by the pets. And so that's something important as well to keep in mind. Like there is, when you treat your pet correctly, there is love all the way, and there is no questions about it. It's the pet will follow you as long as you treat it right.
Totally agree. That makes it's a huge point, or it's an important point, that there's this kind of caring environment without any judgment, and it's about compassion, it's about respect, and definitely then also responsibility in a positive way.
So this idea of dependence, of course, brings us directly to some of the most difficult ethical questions, right? Or moments. So both of you work with euthanasia, though in a very different context. Dennis, what do your field teach us about dignity, compassion, and the limits of care when ending a life?
So from the medical point of view, ending a life is never easy. So it's the same for pets. Ending a life is never easy. And so although we have a legislation on medical assistance in dying for almost 25 years now, so we have a law since 2002, same as the Netherlands, you never get used to it. Even as a society, we still have discussions on must it be possible or not. But in nursing, also in medical care, dignity is seen as an essential goal. So this is something we have to keep in mind. And so dignity means we have to respect someone's autonomy, but also supporting their wishes and ensuring their self-worth. And this is especially when the suffering becomes unbearable. And that's a key point. The suffering becomes unbearable. And so when we have to be compassionate in care, it means not only to support the wishes of the patient, but also just be there, listen to the patient, and if necessary, advocating for the patient's wishes. So it's an important role for nurses. And so these nursing ethics, we will try to elevate suffering and promoting a dignified death. And the dignified death can be in a natural way, but can also be with medical assistance in dying.
Thank you, Dennis. Svenja, and I'm going to up this one a little bit, is how does veterinary medicine interpret this same question, given the differences in pet species, context, and consent, of course?
Yeah. So, of course, and here I would agree, and I think that's also the same issue we have in veterinary medicine, or an aspect that, of course, ending a life is not easy. So, and of course, we can also observe based on studies that, of course, from a technical point of view, to euthanize an animal and getting a routine makes it a bit easier in a way to handle it. But of course, you not getting used to it. And it's interesting that we just conducted an interview study with veterinarians focusing on palliative care. And of course, the discussion also was about euthanasia. And here, especially veterinarians with more years of experience, that were longer in veterinary profession, they said, well, getting older in this veterinary profession, even though you ask more yourself, okay, what I'm doing here in a way. So this has something to do. It doesn't mean that when you have more experience that you get used to it. So this is the same here. I think when we talk about euthanasia, especially in small animal practice, there are differences in a way because we have to make a proxy decisions. So we cannot ask the animal patients, okay, what do you want to do? We have a kind of presumed best interest of the animal patient. And of course, here you need a clear or a good basis for justification, also from an ethical point of view, to euthanize an animal. And that makes euthanasia also so interesting. When we talk about euthanasia per definition, so per definition, then you say, well, it's about OI, it's about thanatos, it should be a good death. And it should be the good death for the patient that is killed, for example, the dog or the animal. And that makes it, of course, also very important to consider, because in veterinary practice, we are also trained to kill animals for food production. We are trained to cull animals for, again, that we can consider here epidemic outbreaks or stuff. We are trained in many ways to kill animals, and all the time we are trained to think about what is the best way from a technical point of view. But the differentiation to euthanasia is actually, when we talk about euthanasia in veterinary practice, it should be killing an animal in the presumed best interest. But of course, it sounds good, and it is from a technical point of view fine. But when we go into practice, we know that there are limitations. And you addressed in your question, for example, limits of care. And of course, we need to consider that, for example, in small animal practice, the owners has to pay the bill. So we have a totally different context in a way, how we can treat, how far can we go with the medical care of an animal patient, thinking about, we have a huge development. There's a lot of things we can do now in small animal practice. So treating oncological patients with chemotherapy, radiation therapy. But of course, these are, I would say here from this point of view, the limitations increasingly reduce. In a way, we can do a lot. But of course, we need always think about, and that comes also to the equation here, do we have an owner who can pay for this? And do we have an owner who can also take care of this sick animal? Brings me to the debate, of course, what about palliative care and stuff like this? This is also a new area we can find. So I would say the limits of care when ending a life is definitely different when we compare it to human medicine. So here I think we have differences, because it is a different context where we make decisions, because it's not only about the patient and the physician or the nurse, it's about the patient, it's about the owner, and it's about the veterinarian. So this is the typical triangle we have in veterinary practice, and how we need to structure decision-making processes.
Yeah. And now we see that these dimensions are not only ethically complex, right? They also place a substantial emotional weight on professionals. And both of you already touched that. Veterinarians and physicians both face emotional strain around euthanasia and ethical conflict. Svenja, what forms of moral stress or moral injury occur in your field, and what kind of support or reflection are mostly needed?
So when we stick to the context of euthanasia, then from the web, so I think it's important to note that I would say that in general, in the veterinary profession, the vets agree that this is a very important tool we have in order to, as you just said, Dennis, of course, to elevate suffering, and then we can, in case we cannot eliminate suffering, and we have a kind of threshold, the animal suffering a lot, so that you can say, I can just provide help here, and then we can just let the animal go. So in general, I would say this is a kind of agreement we can find within the profession. But of course, ethically challenging situations are, for example, when there are owners who cannot take part of their animal patient, and we need their agreement. And this is definitely, that's a very stressful situation. When you have an animal owner who said, I don't want that you euthanize the animal, even though from a medical point of view, you as a vet would say, but now it's the time. We should think about euthanasia. But of course, you cannot force the animal owner. So this means, and this is stressing the veterinarian in a situation that you need to work with the animal owner, need to discuss that really now it's the time. And this is definitely, that's challenging for them. But it can also be the other way around, as I just said, related to the questions beforehand, that we have also animal owners who said, I cannot afford this therapy or this diagnostic step. So now we need maybe to euthanize it, even though you know as a vet, okay, I can do much more. And we know based on data we gained that this is actually a rather regular situation, that you always have to make compromises in the care. And sometimes you come to the situation where you have to euthanize an animal earlier because of financial limitations. And we know this is a very, very stressful situation within the profession, and causes a lot of moral stress also, because you can do something, you can do it better, but actually you can't because of this complex situation or relationships we find in veterinary medicine.
So Dennis, how this resonates with the emotional landscape in human medicine?
So it's the same idea, and there are lots of similarities, unless in human medicine you don't need consent of the owner or the partner or the family. But the difficulty is, as a nurse or as a physician, you step into the profession and you are trained to treat patients, to get people better. I think none of the nurses or medical doctors starts with the education, with the idea, and now I want to do euthanasia, or I want to go for a dignified death. So that's one thing. Another thing we noticed is, so we questioned the Flemish final year nursing students. So these are the ones who had got all their theoretical practice and now going into the work field. So it's a final year, and about their attitudes and their role and their skills according to euthanasia. And then we found out almost 60% of all final year nursing students was ever confronted with euthanasia. It could be during practice or in private life. And then we ask, and how skilled do you feel to deal with it? And they felt totally not skilled. And then we had interviews asking them, and what are the things, and that's one of the things they mentioned is like, we are not trained, but it's also not our goal. Then they also mentioned, like, there are no protocols, so we have a lack of protocols. But also they mentioned, like, there's a conflict between our personal values and the institutional protocols, meaning you have some hospitals who are just asking when a physician wants to do euthanasia, it's just the legal rules, but you have other hospitals and they want extra, for example, extra physicians to be involved to make a decision, or they want the medical committee to be involved in the decision-making process. And so that's very hard for them to understand, like, in this hospital, it is the way, just a legal procedure. In another hospital, you have more procedures. And then you have an elderly home, for example, where it cannot be, you cannot even speak about euthanasia or medical assistance in dying. And they mentioned like these conflicts, and that's made us anxious, but also powerless, and it can lead to burnout. So there was one student who mentioned like she was in an internal medicine ward for doing their internship as a first-year student. So she mentioned as a first-year student, she had 4 weeks of internship. And during those 4 weeks, if I remember it well, there were 15 patients who died. Not by euthanasia, just died in a natural way. And she mentioned, I couldn't handle it. And this makes it now for me more difficult to approach to euthanasia, because I still are dealing with my experiences from this first internship. And so as an education, that's some of our things. We need to learn students how to reflect on what they experienced, but also support them in some kind of reflection groups or focus groups so they can tell their story, but also to learn students how to deal with that, besides euthanasia, just with that. And so what do we need to do? And that's why we took action. And so now we organize these supervising groups after an intern or doing an internship and after the internship, so they can they can share their experiences. And it is not necessarily about that. It's just, but we make sure that we go deeper into as just a description of the activities they undertook.
Colleen?
I think that's a very important aspect you just mentioned, is because it is burdensome, and to provide room, time, and space, not only for own reflections, but for discussions among peers who experience that. And what we did here, for example, at the university, we provide clinical ethics support services. In a way, a team for example, they have to make a decision for a case, and it seems to be very stressful for them, and they need support here. So you can implement some systems and structures or institutions to support, as an external person, their discussions surrounding, for example, a case, or surrounding ethical issues within the whole profession. And I think that's the point you just addressed, Dennis, to provide the time. It's the same important level from my point of view to think about the ethical implications within the profession or within decision-making processes on the same level as the medical aspects. And I think we need to, from my point of view, what we definitely need more, that there's this kind of culture, that there's room for these discussions, and that this is important, and it should be very natural and usual that we discuss this also from an ethical point of view, especially in veterinary medicine, and not only from a medical point of view. I think we need a new cultivation, so to say, to come up with these topics and to provide room. And this should be done in a very natural way. So I think I agree here that it's the most important support we can offer here. Room for discussion, space, time.
That's something I think the management should take into account, because although it will be time consuming, I agree it will be time consuming, but if you do not pay attention to this, then you have the risk that people are leaving the profession. And so in my opinion, and I guess that's in lots of European countries, there is a lack of nurses. So if you pay attention, or you give the possibility to ethics in nursing, even on the working field, so at the ward, then hopefully you will be able, that your nurses will stay within your hospital. So this is now more from a financial point of view or a management point of view, but that's one of the ways to keep your nurses with you in the hospital, because you need that. There's a lack of nurses.
But these emotional burdens also emerge from the way society values animals differently, sometimes inconsistently, right? So Svenja, society grieves deeply for pets while accepting large-scale killing of animals for food. What do you think? Why do you think these distinctions persist, and what ethical implications follow from them?
Yeah, well, of course, this is a huge question, and we can actually discuss hours about that. But I think when we talk about these reasons for moral distinctions, when I just should name four aspects, then I think, of course, it's the emotional bond which makes these distinctions. We know companionship. As I just said at the very beginning, pets are often seen as family members. We know that, leading to strong emotional attachment. And of course, this tends also to an individual recognition. So people tend to empathize more with the animals they know personally, so which may not extend to animals raised for food, for example. Then also the aspect cultural norms. So traditions and socializations is something which definitely leads to such a distinction. So within a specific culture, within a specific socialization, humans are socialized to view certain animals as companions, dogs and cats, as here, for example, and others as livestock, just cows and pigs. But let's go to another country. So we know that some countries, they eat dogs, and some countries or religions, they take care and make palliative care for cows. So there are different socializations, and I think this definitely is one important aspect we need to consider here. I think also about perceived utility. So it's also an aspect of functionality we have here. So animals that serve clear roles as companionship or protection are often valued more highly than those seen maybe as primarily food resources or sources. And this cognitive dissonance is something where I would say that, of course, people may reconcile here that their dietary choices with their emotional responses to compartmentalization, these feelings about different ways. So that we have a lot of research also in this field, that we have this cognitive dissonance between these animals actually kept for food and animals that are kept that we have in our houses and at home. And I think these are the reasons for the moral distinction they are discussed, which leads to that.
Dennis, would you like to add to your perspective to that?
When I listened to your answers, Svenja, which I also completely agree, and then I thought about the previous question. And this is also about broadening empathy and moral responsibility to all animals. But as you mentioned, like there are differences in between cultures and economical factors. But this is, I tried to link this to the human perspective, but I couldn't find an answer to this one from a human perspective.
Mm. So these inconsistencies, right, also arise deeper questions about who can decide for whom, right? Especially regarding autonomy and consent, right? And then how do your field navigate consent, and what can veterinary medicine learn from you or from human medicine?
Yeah. So autonomy is the foundational principle. So that's clear. And so in every definition by every country and every law, it's always stated that a request for end of life must be the explicit request of the patient. So, and so this principle, it respects the personal values and the beliefs and the rights. So that's important. It's always the explicit request of the patient. With animals, besides, we have Samson, our famous television dog, who can speak, but besides in cartoons, animals do not speak. So that's one difference in human care. It's always the patient, the explicit request. In animals, it will be the owner. But I think there can be something that we can learn, is this proxy decision making. So now, by legally, it is possible that a patient asks for euthanasia. This patient does not want that his family or friends are informed or involved. And so this patient will get his euthanasia, if it's approved, will get its euthanasia without anyone knowing it or being present during the act of euthanasia. So legally, that's completely possible. It's not the goal of euthanasia, so it's not the meaning of the possibility to have euthanasia, but legally it is possible. Now, something else is there is a large discussion now in the Netherlands as well as in Belgium. So in the Netherlands, it is legal to have euthanasia in an advanced stage of dementia. So if you said beforehand in your statement of will, just for example, when I'm not able to recognize my children or my partner anymore, I'm not aware of the time and the place where I am not able to take care of myself anymore. When I'm in that phase of dementia, I would like to have euthanasia. In the Netherlands, that's a possibility. So the patient is not competent anymore because he's in an advanced stage of dementia, but that's a possibility. In Belgium, it is not a possibility for the moment. So in the Netherlands, they have a discussion, should we keep this as a legal possibility or not? And the same is in Belgium, should we add this to our current law to make it a possibility or not? And in that way, then the proxy decision-making will be very important. Because at that point, it will be the partner or the children or friends who have to mention, you know, there is a statement of will, and now we think it's the time for this patient to have the euthanasia. So I think we can learn from veterinarians in that perspective.
Thank you. So Svenja, would you like to add the veterinary medicine perspective to that, please?
Yeah, of course. Here it is interesting because we always have to deal, to say it in your words, with not competent patients in a way that they can verbalize their own wishes and can say, okay, this is now my wish or my interest to pursue with this or to stop with that. So we are always confronted with decision making on behalf of animals. And here, of course, we need the owner consent in a way that we need to bring in the decision making the interest or the information by the owners and also the animal welfare consideration. And I think here, of course, veterinarians would like to prioritize the welfare of the animal, but the decisions have to be made based on owners' wishes, including also the animal interest wishes. And I think that makes it totally different when we compare it to the field of human medicine. And we have a limited autonomy, but it highlights also that we have very complex communication. So it increases here the complexities of communication because we need to bring in the owner, we need the information from the owner. And I'm always saying also my students, okay, when you're studying veterinary medicine, because most of them say, I don't like human beings, that's why I become a vet. And then I'm telling them, then you're not doing the right job, because you need the animal owner to find out what is for the best for the animal patient. Usually the dog or the cat is not coming on its own to the veterinarian, it's coming with the animal owner. And here you need to bring in not only the owner's wishes or what's going on in the life and how do they keep the animals, and at the same, of course, also the wishes or the presumed interest of the animal patient. But you need to know how to communicate and to come to a shared decision-making processes for the animal patient together with the animal owner. And this is very complex, and this is not that easy, especially when you have not, when you disagree, for example, with the owner's approach, or when the owner disagrees with your approach as a veterinarian, then it's a really hard work and it's really stressful in that way. So it's different because you always have to act between both sides or with both the animal patient and the animal owner. What we can learn from human medicine, and what I observed also based on research we conducted, is that in veterinary medicine, we need to learn to incorporate more comprehensive owner education about treatment options. Sometimes it just happened that, for example, veterinarians also stated that in a study, well, sometimes I just make my assumption that this owner will definitely not pay that or doesn't want to treat in that way. So I'm not providing all the options. And then they say, well, that's actually not good way how to handle it. So learning, okay, these are the options, and we have an increase in options, providing that, and based on these shared, or based on all the shared information and options we have, coming to a decision. And this is something which I think in human medicine, is running very well. And I think this is what we can learn from human medicine.
And I don't know how it is in veterinary medicine, but like in when I have a look at our own legislation in Belgium, so this legislation explains the complete procedure a physician has to follow. So for example, and he has to fulfill a document afterwards to make sure to explain how all the legal requirements were fulfilled. So for example, he needs to make sure the patient is competent. So the patient knows what it means when I ask for euthanasia and I get euthanasia, this will lead to my own death. So then the physician has to make sure, has to explain in his document, how did you make sure the patient was competent? Then the physician needs to discuss palliative care options. The physician needs to ask, like, do you want family or friends to be informed or involved? Do you need my assistance in explaining this? How are all evidence-based treatments, have they been tried? So are there no other evidence-based treatments possible in your situation? If there is a nursing team which was in regular contact with the patient, did I involved or did I ask advice from this nursing team? So there are lots of requirements. And another one is, and that might be something for veterinary medicine, so when you have a patient, an adult patient, in a terminal phase of life, then you need the advice of one other independent physician. So this needs to be independent from the executing physician, independent from the patient. If it is the case for a non-terminal disease, for example, a psychiatric patient, then you need the advice of two other doctors. And one of them needs to be a specialist in the condition of the patient. So it's not a decision you have to take on your own. You always need an advice from one or two other professionals. So it's all. I just mentioned. So it's always a shared decision.
And I think that's an important point. And just from the legal point of view, that's maybe also very interesting, because in Austria and Germany, we have here legally written that we need a justified reason to kill an animal. So this means that when you kill or euthanize an animal patient, they need a kind of justification why we're doing this. And this is actually what is not in common, also not in European countries. So thinking about UK or thinking about Denmark. In Denmark, you can kill the puppies, I think, within the first 7 days, and you do not need. This is not sanctions by the law. So this is actually fine in a way. And here we need a justified reason. And when I'm talking to veterinarians or speaking also to students, and they say, well, but what is a justifying reason? What is the justified reason? And I think, well, this is something you need to fill with your responsibility, your professional responsibility with your ethos. And I think this is also kind of term and concept which goes with the time, because maybe 20 years ago, there was a reason which is not justified right now. You know what I mean? That it goes also with the moral values or the principles we have, how we would like to treat animals, that today something is justified to kill an animal, and maybe in 20 years it's not justified anymore, because this term, this justified reason, can go along with our development also of our moral infrastructure, how we would like to treat animal patients, or in what situations we would like to kill. So it makes it very hard here, for example, in Austria, to kill based on convenient reason. This is actually not included in the justified reason. So this is something which makes it very different from Austria, Germany, in comparison to other European countries, that we have this that we need this justified reason to euthanize an animal patient.
Yeah, and it seems that it's the same way as in Slovenia.
In Slovenia, it's the same way. Yeah, so true. Mm-hmm.
And of course, considering your professional perspectives, right? What should students in both fields learn about empathy, responsibility, and moral courage when facing end-of-life decisions and the ethical dilemmas that accompany them. Dennis, would you like to start on that, please?
Yeah. So when I first read this question and then what they need to learn about empathy, I don't think you can learn empathy. It's something you have, it's something natural to have empathy, but it's our job to make sure that they know how to deal with their empathy. And specifically when you choose for healthcare, whether it is veterinary, animal care or human care, you need empathy, otherwise you cannot take care of someone else. And so that's something that by learning them and do, for example, simulation education, and they experience how it is like active listening, emotional presence, respect for dignity, and that's something they need to do, and they need to challenge themselves, and we need to challenge them. But it's something natural. You have empathy when you go into healthcare. Another part, I think it's for both professions the same, the case, they need a knowledge of palliative care. So palliative care offers a lot of options to patients, whether these are humans or animals. And so still they need to try all possibilities within palliative care before going to end-of-life care, because palliative care is not the same as end-of-life care. And so when we choose to educate them in end-of-life care, so that's why we developed this simulation module. We also developed escape games, serious games. And so now, last year, a European project was funded, which is called EuroMate, so Euro for Europe, Mate Medical Assistance in Dying, where we will, together with Warwick in the UK, Lisbon in Portugal, and then Ljubljana, Slovenia, we will develop an educational module on how to deal with end of life. And so there will be a students' event where we will bring in students from 5-6 different countries to discuss end of life options. Because that's also something we need to take in mind, is in Belgium, the Netherlands, we have a long-standing law to euthanasia. Meaning, as I said before, almost 60% of the final year students was already confronted with euthanasia during their internship or in private life. So there is a large acceptance in our society towards euthanasia, specifically for people in terminal care. When you have a look at, for example, England or the UK, where there is no legislation at all about end-of-life care, it is not that common to talk about actively ending a life. And so for our students, it's also important to broaden their visions that, okay, it's not everywhere the same as in Belgium, and it's not that common to discuss, even just discuss, not doing it, to discuss end-of-life options. And the same for other countries, so they can open up like, okay, there are other possibilities as palliative care. And so that's why we have also international projects where we travel with students or we invite students from abroad. I think in most cases, the educational needs are opening, making them know that empathy, active listening, these are things they have by their own, and we need to challenge them to develop these skills. And we have to open up their ethical framework to have it outside their own society and their own group, to have it more abroad to a European vision or even worldwide.
Yeah. Why I included empathy into this question is also because it's so bound to the ethical and moral framework socially, right? It's different, like Svenja mentioned, it's different in Austria than in Denmark, and that's the European Union as per se. So Svenja, I'd love to hear your thoughts on that question.
Yeah, thank you. I think maybe I can just start with the difference that, of course, when students start study veterinary medicine, they know already that they will get trained to kill, and actually they know that they will kill or euthanize an animal at some point. So I think that's a different, and I think this is also something very common in veterinary medicine. And definitely I agree, Dennis, that of course there are huge differences within human medicine when we talk about euthanasia. So this is maybe also, that's a difference, that they start study and they know, okay, at some point I will euthanize an animal, or even often they experience this by themselves with their own animals. I totally agree. Empathy is something that should be there. Maybe you can, but what you can learn is how you can make use of it. And what we identified also based on a study we conducted among veterinarians, that we try to identify how veterinarians juggle different interests within decision-making processes. And what we observed based on the study we conducted is that empathy is the key for everything. And especially in situations I just mentioned, for example, that you need to convince also the animal owner from a certain decision you would like to go with as a veterinarian with the animal, but you need to include here, for example, emotional bonds, that empathy is the key. And it brings you maybe, and at a first glance, brings you away from the interest of the animal patient. But not being empathetic with the animal owner means that this animal owner maybe goes somewhere else or will not come to you again. So this is a kind of showing empathy and showing also respect to, for example, emotions in front of the animal owner, brings you in a roundabout way to the patient. And I think that's really a key we need in veterinary medicine to treat animal patients and also consider here, for example, the animal owner. With responsibility, I think, of course, this is something which is important, because when you think about euthanasia is a decision. So usually you can make decisions where you can say, well, we can try this option, and then the next door will open, we can try this option. When you make a decision for euthanasia, there's no option afterwards. So this is really a door we close. And that's why I think it's, especially for the younger students, or for students or younger professionals, what you just said, Dennis, to think about shared decision-making processes, to discuss it also with other colleagues, so that you don't have to shoulder this responsibility on your own, especially in cases which might be very tricky, for example. So this is something which definitely, because this is a responsibility which differs from making treatment decisions or diagnostic decisions, because that's the last decision you make, and you have to take care of the responsibility here. Moral courage. I think what's also important is to much more develop a kind of identity. What are your moral values behind decisions? Where are you? I think this is something which I also address in the veterinary study, because we train here veterinary students also, and what is so important, that they need to think about their own professional identity, what is very important for them as a vet, because even though there are 200 veterinary students in the room, I know there might be 200 different perspectives on one situation. And then we need to identify where are the differences and why are there differences. And this is also so important to discuss with what kind of identity I'm going in my profession. And also identical questions, for example, am I able to work, for example, in the food production sector, because it definitely is against about my moral convictions, or maybe also consumptions. And these are all these things we need to think about when we train veterinary students, to think about where they would like to go, where they can go, also with their moral infrastructure they bring into the field. I'm not sure how it is in human medicine, but because we are so diverse in veterinary profession, that this is an aspect I'm addressing very early during educational program, to think about what is important for you as a professionalist.
And I would like to add that it's also important that students, and it's in both professions, they are aware of the limits of medicine or veterinary practice. We always will take care of someone in the best interest for the patient or for the animal, but we need to acknowledge there are limits to our possibilities to treat someone. And although we have tried all the best we can, sometimes taking care of someone is accepting that we are not able to do anything. There are no more possibilities. And we need to learn to the students, or we have to place it in their moral compass, that sometimes accepting that there's nothing else we can do is also a possibility.
Yeah.
I think that's important aspect. And you just also mentioned the palliative care, and we just finished the project on palliative care on small animal practice. And there's a lot of people also within the profession said, well, this is just treatments that goes beyond something, and it's kind of extended treatment. That we need to think about palliative care. We need more palliative care, thinking about to eliminate or reduce suffering, to bring the patient to a certain level where we can say, okay, because here are the limits for the diagnostic or treatments we have. And I think when we have this increase in medical options and technologies and sophisticated methods, it's at the same time also very important to have this certain stream of providing palliative care in case we cannot make use of these technologies or these advanced methods we have, for example, in veterinary medicine. So it's not all about where shall we draw the line on treatment with respect to high-tech veterinary medicine, but it's also we need to ask ourselves, how can we provide the best palliative care at certain stages in an animal's life, and also to think about how shall we let the patients die. And I think that's important questions addressing also this palliative care phase. And I hope that this field will also be more implemented in the future, that we focus more on this really interesting part of veterinary profession, namely, if there's something between curing and killing. It's something about caring a patient with its disease. I think that's so important aspects in the veterinary profession, at least.
And this is the same for human care. So we also do hope that there will be more investments in palliative care, because back in the days, a lot of money went to curative care, which is completely fine. And then somewhere in the 70s, beginning of the 80s, they had the idea and the vision of, but if we go for health prevention, then we can achieve lots of goals as well. So they started investing lots of money in preventive healthcare, which is fine as well. And then you have the third phase in healthcare, which is the palliative healthcare, but that's not that supported for the moment. So we do hope, because Euromate is one of these projects now supported by the Erasmus Plus program. So we do hope palliative care will gain more attention at a higher level or at a financial level.
Yeah, that's a thoughtful way to close this podcast. Thank you, Svenja, and thank you, Denis, for sharing your insight and experience with me today, with my audience. Cheers, thank you.
You're very welcome.
Thank you so much.
Thank you, Svenja, and thank you, Denis, for sharing your insights and experiences today. I'd like to wrap up with a short reflection. We discussed difficult but essential topics, the kind of situations that every professional eventually faces when providing compassionate and responsible care. I hope this conversation helps our listeners, especially students, think about what these decisions look like in practice, how to communicate clearly, how to stay grounded in their values, and how to act with calm moral courage when someone, human or animal, depends on them. This podcast is part of the EUTOPIA Learning Community, Veganism versus Animal Protein Consumption, developed with the EUTOPIA European University Alliance. You can learn more about the Alliance and its activities at eutopia-university.eu. Thank you for listening, and we hope you will join us again in the next episode as we continue exploring how animals, humans, and society are connected through care, responsibility, and ethics.